Welcome to St. Alphonsus Wellcast, the podcast where we explore the many facets of health and well-being. This podcast is brought to you by St. Alphonsus Corporate Health and Wellbeing and a generous grant from the St. Alphonsus Foundation. Thanks for listening and enjoy the show.
Hello and welcome to the St. Alphonsus Wellcast. This is Kim Kleaveland, family nurse practitioner with the Department of Corporate Health and Wellbeing. Today we are continuing our series on cognitive impairment and all things brain health. We have Katie Horrocks and Kathleen Little, social workers with the St. Alphonsus Brain Health Memory Center program. Today we are talking about levels of senior care and how to access assisted living. Hi, Kathleen.
Good morning.
And hi, Katie.
Good morning.
Thank you so much for coming on today. This is such an important topic for everybody to hear about who has a loved one or knows anybody who may need increasing levels of care or support as they age. It's a very complex topic, very robust, and a lot of things to consider. And luckily, you have the support of our brain health program and our social workers who can help navigate the landscape. But for those of you who are interested in hearing more about the different levels of care, what they entail, and all the different considerations, we have a little bit of a roadmap for you today to follow. So there are several different levels, and I'll kind of just mention the ones we'll talk about today, and then we'll go into a little more detail. There are 55 and over communities. There are certified family homes, independent living facilities, assisted living, memory care, and then what we consider nursing homes, which if you're ever in the hospital or in a medical setting, you may hear them referred to as rehabs or SNFs, SNFs. So we'll kind of go into a little bit more detail about these if that sounds good to you, Kathleen.
Perfect.
Great. Okay, so let's start with the 55 and up communities. What does this entail? What does this look like? And who might be a good candidate for this?
Yeah, generally people who are 55 years and older and are still wanting to maintain their independence but are wanting to live in a community with others that are like them, they quite often form really good friendships, and they sometimes have meetings at the clubhouse, and, they're usually gated. They're quite often, they have landscaping that's done for them, and it's just sort of easy living with others that are your age and that you find commonality with. And so it's a great way for your loved one to keep their independence, but maybe just have a little bit more feeling of security and socialization.
Okay. Mm-hmm. That sounds palatable for many individuals, regardless
Exactly.
of their level of cognition and ability to care for themselves if they are still very able. Okay, and then how about certified family homes? Can you explain those in a little bit more detail for me?
Yeah, I think certified family homes are a really nice alternative when people are especially watching their budget and want a smaller, more personalized feeling. So for instance, Kim, if you or I were to decide that we wanted to open up a certified family home, maybe we are empty nesters and our kids have moved out of the home and we have a couple of extra rooms that are available, we would go through a process with health and welfare of having background checks. They would probably do a home walkthrough. They would check for things like fire extinguishers and safe exits. And so you go through that process to become a certified family home, and then you can have people come into your home and live in your home, and you would be considered the primary caretaker. You would provide for housekeeping and meals. It's a really nice alternative to assisted living because they're usually anywhere between $1,000 and $2,000 a month, where assisted living will range between $4,000 and $6,000 a month. And many of them will take Medicaid. If you want to find a list of certified family homes, you can go on to healthandwelfare.idaho.gov, and they have a tab that's listed certified family homes.
Mm-hmm. And these are just embedded in normal neighborhoods.
They are.
Sort of just in the community as though.
Yeah, so picture your loved one would have their room, and then they would share the kitchen, the living room, the family room. So it's a real community. They're just in that closeness of that part of it. Yeah, it's nice. The backyard and things like that, all of that is included, for them to live there.
Yeah, and that seems like it might be a really good option for people who may be looking for something a little more smaller, a little more tight-knit. What does it look like as an individual having family members maybe close by want to come visit. If your loved one lives in a certified family home, does that allow for similar visitation, or what's the normal landscape there?
Yeah, absolutely.
Oh, yeah.
So people are free to come and go.
Mhm.
So, I would think that the certified family home providers would encourage that.
Very much so.
So, the idea of continuing to visit people when they're in these homes and get them out of the homes to go out and, live life socially is super important. So
Mhm.
I think it's a really nice alternative for a lot of people, especially people who might feel lost in a larger location. So some people just really want to feel like they're at home.
Mm-hmm.
And they would know the same people. The
Mhm.
same people would be their caregivers.
Yeah, it's like a family.
Yeah. It's a family.
Yeah.
It's a family. Yeah.
Oh, that's a really great option. Okay, so if people are moving toward, less of a smaller community and are looking at bigger options, maybe more commercial options, what does independent living entail versus assisted living?
Yeah, independent living would be where you would probably have your own apartment. You can still drive if you are able, so you can come and go. It's kind of hassle-free living. So think of many of them are very beautiful, and they have common dining areas, and they will provide for weekly housekeeping. But that's usually it. Other than that, you're on your own. So if you need some sort of medical oversight, independent living is probably not for you. They do not have nurses on staff. Many of them will have call bell lights in their room. So if you needed to, if you needed to ring somebody because of an emergency, then they would probably automatically call 911, but there's no actual nursing oversight on the property.
Okay.
Right.
So it's a nice alternative if someone says, I need a little bit more help. I'm kind of growing weary of taking care of the cleaning and the cooking. And I really like the idea that comes from feeling like there's safety in numbers and being with other people. I like the idea of being able to socialize at mealtime, but I don't want to live alone anymore. And yet not quite ready for assisted living yet. That's a nice in between.
Yeah, I'm thinking my own grandmother here, her current situation is very much independent, and it kind of allows for her waxing and waning energy amounts. Sometimes she feels very able to make her own meals and to care for her own place, and then sometimes she's just really tired and wants to rest more, and it kind of allows for that flexibility for her as well.
Sure, and some of the independent livings will have their own little kitchenettes in their rooms.
And they can do that. Or if they don't, then they can go down to the community meals. Yeah.
Yeah, that's a really great option. And then in terms of moving toward assisted living, which would be a little bit higher level of care, what would be that transition point, or what would be the main differences between independent and assisted living?
Sure. So, when Katie discussed earlier activities of daily living skills, so when it becomes more difficult for someone to be able to perhaps toilet themselves or bathe themselves or dress themselves or manage their medications, knowing when to take their medications, how to order their medications. So in assisted living, that's done for you. So for instance, with the medications, all those medications are kept locked up in a medication cart. When they run out, the staff are reordering them. So when it's time for you to take your medication, they're coming to you and handing you the medication and telling you what you're taking and making sure it's done correctly and it's kept track of. And then they're able to assist with, again, toileting, dressing, bathing. They provide for security, for activities. They have really robust activity programming in many of them. And, I think it's a wonderful option for someone if they say, gosh, I don't think I need a nursing home. I think what I need is just more help. Some folks are more independent than others at assisted living. And I think what's nice about it is assisted living is that it allows for that.
Yeah.
So again,
there's different levels.
Sure.
In an assisted living. And
Yeah.
I think that's kind of what you're speaking of.
Sure.
We definitely see a lot of different independent that varies from one to the other.
And depending on the assisted facility itself, the levels will change. So
Yes.
there's not one standardization. So for
Right.
instance, there's not levels 1, 2, and 3 at every assisted living you go to. It
No,
really
they
depends on the
changed.
organization.
Yeah, they change on the facility. Yeah.
Okay, so assisted living is, do they normally have nurses on staff as well, since they are including medications and things like that as well?
That's a great question. So yes and no. So some of the larger ones will have a full-time nurse on staff. That's not actually a regulation. The regulation calls for a nurse to do a head-to-toe assessment upon time of admission, to do quarterly head-to-toe assessments, so that means every 3 months, and if there were to be a significant change of conditions. So, for instance, if someone went to bed alert and they woke up in the morning and they were markedly more confused, that would be a change of condition, right?
If somebody was mobile and then was in a wheelchair, that change would be another reason.
Exactly. So a nurse would need to do an assessment. So some of the smaller facilities will not have a nurse in the building, but they will have a nurse on call 24/7 and meeting those regulations upon time of admission, quarterly, significant change of condition. So the pricing will also usually be impacted by how often the nurse is there. So, if your loved one has a limited amount of need for medical oversight, then probably having a smaller location would probably be fine. Having a nurse that assess them once a quarter, would probably be fine. But if you are very concerned for your loved one's medical needs, then you might consider a location where they have a nurse on hand all the time.
Those are really good considerations. And just in the spirit of brain health and cognitive impairment that we're discussing a lot throughout this series, memory care is another level, another tier of a care that may be required. And what exactly does that entail?
Sure. So assisted living can have memory care buildings. Sometimes they'll have memory care units that are dedicated to those with Alzheimer's and other types of dementia. The staff will have specific training for memory care issues. So it is possible to have your loved one in a assisted living unit that does not have memory care if they have mild cognitive impairment or mild dementia. But if it starts to become more profound, then usually it'll be time to transition to a unit or to a building dedicated to memory care, so that they're with staff that are specifically trained for their needs and their concerns.
And are there generally more staff members available in those types of situations than in an assisted living? Or
there isn't any regulation that requires that, but generally the answer will be yes, just by the sheer needs that they will have in terms of needing help with those ADLs that we talked about, redirection. They'll need more assistance at mealtime. They'll need more assistance for activities to keep them, involved in the activities. Will require just more hands-on and side-by-side interaction. So generally, yes.
Okay. And so these are, many different options. And then we sort of get into like nursing homes and rehab facilities, which to me, in my mind, correct me if I'm wrong, sort of represent their own arena of, maybe more strictly regulated, and more staff on hand, more nurses on hand, things like that. Can you speak a little bit to the regulations that are there for the skilled nursing facilities or nursing homes or rehab facilities?
Yeah, I think assisted living is a great option for usually a chapter of time. Sometimes people will be able to stay there till the end of life, but when someone becomes a danger to themselves or other people, or they become beyond the level of care for assisted living. So let's say, for instance, they were to need a ventilator or a trach. There's many skilled reasons why someone can no longer be managed in assisted living. They would need to go to a nursing home. Nursing homes tend to be more expensive, obviously, than most assisted livings. And so they can be quite pricey. And so that's often a reason why people are looking for other alternatives. But, they certainly have a lot more staffing, options in terms of quite often they'll have OTs on staff and PTs and physical therapists and occupational therapists and speech therapists and respiratory therapists and RNs and LPNs and social workers on staff. So if someone is needing around the clock care in a facility with lots of different staffing options and needing that type of oversight, that's a great option for them.
So kind of like a little mini lower level of care hospital almost.
Yeah,
in
that's
many
a great
ways.
description.
Yeah, exactly.
Okay, so there's a lot of different levels here. I'd like to get in a little bit to talk about things you might want to think about or consider when thinking about the care your loved one may need going forward throughout their lifespan. But the first thing that kind of hops into my mind is many individuals who are older may or may not have a spouse that's still living and may require different levels of care for them or the same level. What does that look like at some of these facilities if you're hoping to maintain that closeness with your spouse or your significant other, and how is that usually accounted for?
Yeah. No, I think that's a great question. So, there are communities where they have all three, where they would have independent living, assisted living, and, the skilled care or nursing home portion. And so that's a really nice option where you would still be on the same property, but perhaps you wouldn't be in the same building or on the same units.
And memory care too. And memory care would be included in those too.
Yeah.
So
that's a great option. I think that sometimes people can start out together in assisted living, and then maybe somebody needs to go on to the nursing home.
Right.
The other person stays in the assisted living. Again, if they're on the same property, that's a really nice option for people to be able to stay together. I think something that we haven't necessarily talked about yet, though, is, and I would want to include, would be the idea of adult daycare and as well as a respite.
yeah.
So sometimes when people aren't quite sure if they're ready to make a commitment to assisted living, and I'm speaking to that a lot just because that's really my background, it's nice to give them a chance to sort of try it on for size. And so this idea that you could go and drop your loved one off for 2 or 3 hours while you needed to run errands, while you needed to have an appointment, kind of gets them more familiar with assisted living, but also gets the person who's dropping them off a sense of used to it, and helps them become hopefully more comfortable with it. And then there's respite, which is overnight. So, if you needed to go out of town and you needed a place for your loved one to stay, but you weren't comfortable with them staying alone, you could have them stay for respite. Many of the assisted livings will allow for that. And again, just gives you this opportunity to kind of try it on for size and see how comfortable you are with them.
Those are all really great options too for people in that sort of messy middle ground where it's not necessarily clear what the next step is. What does that look like in terms of when people are starting to make that transition into considering independent living or assisted living? What are the normal situations that you see that prompt those changes or that make someone maybe more open to or considering that transition?
Yeah, I think quite often if they have a spouse that's passed away, or if they start having more medical issues more frequently, I think it's super important to just sit down and try to have a really loving conversation with your loved one and be as transparent as you can, but as kind as what you can about that. So, we see that handled in lots of different ways by many different people. And usually we see the best results happen when someone approaches it as if, gosh, if this were happening to me, kind of that old, golden rule of how would I want someone to treat me? How would I want someone to approach this with me? It's never an easy conversation to have, but the sooner you can have it, the earlier you can have it in someone's brain health, the easier it will be. So before your loved one becomes confused, before they start to have issues with their brain health, if you can approach these conversations in a loving, open way with your family and really try to understand what it is they would want if something happened to them, then that's going to help you be more prepared for the future. But if that time has come and gone and that window of opportunity has closed, then I think the next best thing is to rally the people in your circle that would be the most likely to be supportive in helping you with this process, and just approach it as openly and together as what you can.
Yeah, a couple of things I'm thinking of just in my background in family medicine and the things that, we used to speak with patients about. The first thing I'd like to highlight too is the Medicare annual wellness visit. For as much, mixed press, I would say that visit has gotten. It's such a powerful time for both clinicians and family members to discuss with individuals as they're aging, sort of what their goals are for themselves and where they where they see themselves aging, because that could look different for every individual, first of all, and then second of all, the level of how realistic that is for them could change from year to year. And that conversation is an ongoing conversation and dialogue, particularly in a setting where it's a little less threatening as part of just an annual check-in, and is, I don't want to say formulaic, but almost like a necessary, I don't want to say box to check, but sort of it gives us a prompt where we have to talk about it every year, which oftentimes, depending on your relationship with your family member or the dynamics that have been at play before, it may be a situation that's been avoided or a conversation that hasn't been had because it is a difficult one at times. So I think, if someone is able to accompany their loved one to that visit, or if their loved one is amenable to that, then it might be a good time too to just have a little powwow as a clinic and with maybe a social worker or just the family physician and talk about what that's looking like at home. I think that can be a really great time to spark that conversation too.
I love that, Kim. Yeah. And we love it. And we ask that when our patients come in, that they bring a family member with them. That's such an important piece of the visit, because when that family member comes with them, then we're able to, at some point during the appointment, hopefully pull them aside and have a chance to, hear some of the things that are on their mind and some of their observations, and having the observations of family members and your support team is super important. It gives us a whole nother level of insight into how to help people.
Yes. Yeah. We understand their day to day so much more. Just the insight that they bring, the family members is immeasurable. Yeah.
That's really great. So we know what our options are. We've talked about sort of how to transition or what that transition might look like. Let's talk a little bit about cost. You mentioned that there may be more cost depending on the tiers of care. What can individuals be expecting for level of cost if they decide they need more care and assistance?
Yeah, I think you could probably find an assisted living somewhere between $3,500 and $4,500 would be on the low end. Generally speaking, probably the more average cost would be somewhere between $5,000 and $6,000. Sometimes memory care can go up from there. Again, it will have a lot to do with the size of the assisted living. So, usually the larger they are, usually the more amenities that they have. And usually you'll pay accordingly for that. And so, the smaller ones are anywhere from 8 to 16 beds. And, they're usually the ones that are going to be down between $4,000 and $5,000 has been my experience. And so, assisted livings can take long-term care insurance. So if we can talk a minute about pricing.
Yeah.
A lot of people don't even realize they have a long-term care insurance policy. So I always encourage people to ask that question. Quite often it's one that maybe you bought 20 years or 30 years ago and your loved one didn't even know they had it. And so that's super important to ask that question. And then many of them will take Medicaid. So Medicaid is based on income. It's a state-funded program. And then it's private pay. A lot of times our seniors will get confused between Medicare and Medicaid, and Medicare does not pay for assisted living.
Okay. So definitely the Medicaid only, and then private pay from there.
And long-term care insurance.
Long-term care insurance. And what options are available for veterans? Are there other options for those who have served?
There is. There's a program through the Veterans Administration called Aid in Attendance. And so if you are a veteran, we very much encourage you to access those benefits and to see if you would be eligible.
Okay. So fairly expensive, we're looking at for really any other care. You mentioned too, the certified family homes sometimes can be a little less expensive potentially for individuals too who are on a budget.
I think they're generally about half the cost of assisted living, if not a little bit less. Again, probably depending on the size of the certified family home.
Right. Okay. And then in terms of finding an assisted living, how does one go about finding a good fit for them or finding any that are available or that have room for them in space?
Yeah, they can go to the healthandwelfare.idaho.gov.
Okay.
And they will have a list of assisted livings and certified family homes as well as nursing homes. And they have a list of also the surveys that you can find online. And I don't think a survey of a facility tells the whole story. But But I think it certainly helps tell a piece of the story of someone's track record. And there's also several agencies in the area that you can plug into. You can call Katie or myself, and we can give you their names, and they do nothing but help you find these locations, and then they charge the facility if you move in. They don't charge you.
Oh, okay.
And so there's several of them in the area that we recommend frequently. So if you're interested, we were happy to give you those names, and you can reach out to us, and we'd share that information with you gladly.
Okay. Yeah, those seem like good resources for individuals who might need that little bit of extra help and assistance navigating it. It's a complex landscape and lots of locations everywhere and lots of big names and small names and all sorts of things. If someone decides they are going to move into assisted living, what do they need to do? What do they need to bring with them? What kind of documentation is required?
Yeah, no, great question. So if you decide that you want to move into assisted living, the best thing to do would be, I would suggest taking a tour. We suggest taking tours at not always necessarily scheduled times. So I would be interested to know, if I were looking for an assisted living for my loved one, what happens on the weekends. So I might be tempted to drop in on a Saturday afternoon or in the evening during the week. If you're wanting to meet with the executive director or the administrator, they use those names interchangeably. You can call and schedule an appointment and start a dialogue with them. Some of them will have their own furniture that you can rent. Some of them will have furniture that is already there for you to use, and then some of them will allow you for you to bring your own furniture. They will need a history and physical from the physician within the last 6 months. Some of them require a shorter time frame than that, so that's why you'll really want to check with them about what their admission policy says. They will need a list of medications from the patient's physician that's signed, and they may have some other miscellaneous documents, but the history and physical and the signed medication orders are the big ones.
For sure. I can see those being really important, particularly if they are requiring a higher level of care.
And then, of course, you'd want to bring some things that would just help make their room feel a little bit more familiar to them. So maybe a special blanket or some pictures. You'll want to bring their personal hygiene items, bring some of their favorite clothes, things that are comfortable for them to get off and on, some slippers. But, what's nice about that is that you always have the option. If you don't get it all the first day, then, you can always add to as time goes on. And, anything you can do to help make their space feel more personalized to them will help them probably feel more comfortable in their surroundings.
Yeah, that all makes a lot of sense. And then, what happens if someone shows up and they sort of settle in and then they decide after a period of time it's just not for them or they're not happy where they are? What does that look like?
Yeah, I always encourage people to give it a little bit of time. If you think about it, a move for any of us takes a lot of adjusting. It can be very stressful. And so, I don't think you can really make up your mind in the first day, the first week, unless something, egregious has happened.
Right.
And there's huge red flags for you for some reason. I would really encourage you to give it 30 days. And then if you are, for some reason, dissatisfied on behalf of your loved one, I would encourage you to seek out the administrator. And, Katie we were brainstorming some ideas the other day, and she had mentioned, the idea of wouldn't it be helpful if people wrote down a list of concerns they had. So when they went to talk to the administrator, that they could remember what all those concerns are and try to give some times and dates to when that specifically happened, and that will help the administrator have a better understanding of what your concerns are. And then if you want to schedule a follow-up meeting to that. But it's hard for people to know how to make change if they don't know what your concerns are, and so to just leave or to just move out without having made your concerns or your needs known doesn't really help the situation.
Yeah.
And it can be hard on you as well as your loved one to turn around and move them again. So I think it's always better to try to find workable solutions.
Yes.
Plus there's often a move-in fee when you're moving from building to building, so it can be expensive as well as labor intensive to move everything. So
right. Yeah. Hearing a lot of common threads with communication and sort of all of our, basic tenets of humanity and connection and maintaining open communication between both us and our loved ones, and then those who are assisting in the care of our loved ones as well, to be sure that everybody's needs are met.
Absolutely.
Mm-hmm.
Yeah. Well, this is a really great comprehensive review of different options for individuals. And, for those of you listening, this is probably still very complex and may have left with more questions than answers. And we're always here for you at the Brain Health Memory Center program. And our social workers are happy to talk through these individual case-by-case situations to provide that support and help individualize a plan that works for everybody. So thank you so much for providing this introduction, and we look forward to talking to you again.
Thank you so much.
Yeah, thank you very much for having us.
Have a great day.
You too.
Thank you for listening to this episode of St. Alphonsus Willcast, brought to you by St. Alphonsus Corporate Health and Wellbeing and the St. Alphonsus Foundation. Always be sure to catch new episodes by subscribing to us through all major podcast platforms, including Apple, Google, and Spotify. We hope you'll tune in again. Until then, be well.